Hello, this is Dr. Hansen. Another set of short videos here. We're going to be talking today about anti-obesity medicine, specifically the injectable products. So let's go ahead and get started with that. First off, this does not constitute medical advice. If you are interested in these products, you should contact your physician, your MD, your DO, for advice on these with regards to the treatment of diabetes and specifically the treatment of obesity and weight loss. So let's keep going here. These medicines, these injectables actually derive themselves from the saliva of this thing, a Gila monster. And they found that it would actually help with the treatment of diabetes. So that's how this ball all got rolling. These injectables are FDA approved primarily for the treatment of diabetes. They help the pancreas with increasing secretion of insulin when there's glucose around, not when there's no glucose around, but just helps the pancreas. And they also block certain receptors that are using a product of glucagon, which increases glucose in the serum. The newer product, the Mounjaro, also works on a different axon, a different polypeptide, but we won't get into the details about that. But it's slightly different than the rest of the injectables. The main thing they do is they delay gastric emptying. So when you eat food, which is then it gets in your stomach, it's supposed to move to the small intestines in a measured rate. These chemicals reduce that rate so the stomach stays full longer. It also creates a sensation of early satiety, and that happens probably in the brain, where the brain feels like it's got enough to eat. It doesn't need to eat anymore. So appetite gets reduced. Additionally, as I mentioned, it suppresses glucagon secretion so that glucose elevations are less prevalent. And we do know that these injectable products help with glucose levels, diabetes, and A1C levels. That's for sure. It also improves outcomes. Some of these things show some data that they may actually reduce the incidence of heart disease or something like that. But that's sort of tenuous and not that strong of a component. But nevertheless, there's some data on that. And one thing we have found out is that these agents in the treatment of diabetes also help people lose weight, not gain weight, which is very important. So we'll go to the first one. The first one out was Byetta, exenatide. It was a twice daily injection. Came out with products that, again, just not too much before were derived from the Gila monster. These products actually did help reduce glucose, and these are delivered by little injector pens. Patients gives them themselves, and they work really well. So Byetta was the first, but you had to do it twice a day. A bit cumbersome. Then Byetta came out with an extended release version by Durion. Now these products in early studies showed that possibly in people or rats that had certain propensity for thyroid tumors and stuff, that it might cause that. So it's never been found to cause tumors in humans, but there's still the warning that if you have certain types of history of cancer, especially the thyroid in you or your family, that you not use these products. But Durion was the first one out and is a once a week version. Yep, this twice a day medication became formulated as a once a week injection, much more convenient. The next agent that came out was Victoza or liraglutide, Novo Nordisk product. That was a once a day injection, and you could really fine tune how much you gave somebody. But they worked really well. The major side effect we saw with this, as with all of these products that end with glutide, is nausea. Some people would get excessive nausea, even to the point of vomiting. You'll see sometimes side effects like bloating or like a sulfur type of belch, but these are all kind of benign things that you can handle. The next product came out is a product of Lilly. It's called Trulicity or dulaglutide. That had a once weekly injector, very convenient, extremely convenient injector. The next agent that came out was a Novo product, again, the same manufacturers of Victoza. Ozempic, the chemical in that was semaglutide or semaglutide. That was a once weekly thing, and it has a pre-filled pen injector that you dial up and give yourself the shot, again, with really small needles and easy to tolerate. The next agent out is really just an oral version of semaglutide. Novo Nordisk was able to come out with something called Rybelsus, which is a pill version that the semaglutide does not get destroyed by your gastric acids or your intestinal enzymes. So this actually does work also for diabetes, an oral version essentially of Ozempic. The next agent that comes out for this product class is the relatively new product called Mounjaro. That's a product by Lilly, the manufacturers of Trulicity. It's tirzepatide. It's the GLP product, but there's an additional component which I've mentioned as about the way it works. But again, for diabetes, it is not indicated for weight loss as of May 2023. I do know that they're undergoing studies to evaluate it for that, and I anticipate that they would get granted the indication for that. So these injectables that I mentioned are approved for the treatment of diabetes. However, there are injectables that are approved for treatment of obesity. And they're essentially for higher doses of two of these agents I already mentioned. They just have a different brand name, but the same chemical. And the original brand name is not FDA approved for weight loss, but the same chemical under a different brand name is approved for obesity treatment. Anyway, so you remember Victoza, that once a day injection from Novo Nordisk, liraglutide. Well, they recompounded it as a product called Saxenda. It's the exact same chemical, different quantity. But Saxenda did get FDA approval for weight loss. Victoza, the same chemical, has not been approved for weight loss. Minor thing, but a major thing. Ozempic, we heard about that. That was the once weekly one, semaglutide. Well, when they repackaged that and studied it for specifically for weight loss, not for diabetes, they found that it worked. So they called that brand name Wegovy. Again, G with a hard G, Wegovy. So it's the same chemical, semaglutide, different brand name, marketed for a different purpose. The newest injectable, as I mentioned, Mounjaro, is not approved for obesity treatment. It's a receptor agonist that works on a couple different mechanisms. It's FDA approved for diabetes treatment only, this chemical, but it's not approved for obesity treatment as of May 2023, that is. Again, Mounjaro is tirzepatide, and it has a dual action to it. Again, great diabetes drug, and it does, in diabetes studies, have weight reduction associated with it. It's just not specifically studied and approved by the FDA for weight reduction. Here are the costs of some of these things. Mounjaro is not included, but just throw it in the mix. You're looking at about $1,000 a month. You can see on the right. Let's just use that as a ballpark. Very expensive. Mounjaro is going to come in higher than that. Is it worth it? If you didn't have insurance, if you assume this stuff is $1,000 a month, and let's say somehow another crystal ball would tell you that you would lose 1 pound a week or 52 pounds a year, would a person spend $12,000 over the course of that 1 year if they knew for sure that they'd lose 52 pounds? Well, a lot of people would, because they've already spent tons of money on weight loss attempts, programs, special diets, etc. The amount of food it takes to build up that amount of weight itself costs money. So some people might actually be worth paying that amount for it, but most of the time that's cost prohibitive for most people. I do have to bring up one item which is a concern. Weight loss clinics over the past 6+ months have popped up that have involved with using semaglutide. These clinics are run by either pharmacists or nurse practitioners. I have seen some clinics, weight loss clinics, actually with MDs involved, which is kind of scary. But the semaglutide that they're giving is not Ozempic or Wegovy. The semaglutide they're getting are these vials, and they're not pens or injections. Now, I know semaglutide, the patent is owned by Novo Nordisk. So Novo Nordisk is not making these 2.5 milligram vials. So they're getting bootleg vials from somewhere. We don't know where. But the pharmacies are compounding this with other stuff, meaning they mix it. Like they'll mix this bootleg semaglutide with B12, as if that makes a hill of beans difference. There's a loophole in the law that allows that to happen. And it's untraceable quality control. These agents, we don't know where this stuff is coming from. And it's a bootleg type of feel to it. I do know that there's a pharmacy in Fort Lauderdale who seems to be the epicenter of a lot of this semaglutide vials coming in. But I don't know. And these clinics are charging a couple $100 a month for people to come in every week, or to be given 4 syringefuls of this vial of stuff for them to give themselves at home. It works. I do see people losing weight on it, but we don't know the quality of the product. We don't know where it's even from or who makes it. This is a kind of an image here. You can see that on the right is this vial, the semaglutide sodium. And you can see on the left is a box this comes in. Again, it says semaglutide sodium. And that's important to know. This is not how medical grade semaglutide comes. It either comes in a pen or an injector, nothing else. And when we look at this with a little more detail, we can see that the semaglutide that comes as the bootleg, as I call it, the semaglutide sodium and the semaglutide acetate, those are not FDA approved. They're not. The semaglutide base that you find in Wegovy and Ozempic, that is FDA approved for weight loss and diabetes, respectively. Not the sodium or the acetate version of semaglutide. And I would point this out. This is published by the Mississippi Board of Pharmacy. I am licensed to practice in Mississippi. Mississippi Board of Pharmacy. And in this, they show that semaglutide does not have a USP monograph. Semaglutide base is, in fact, the FDA-approved product, not semaglutide sodium or acetate. So when a pharmacy is compounding this, they're compounding stuff with a product that is not FDA-approved. And that does not meet the bulk substance requirements, and it is not a legitimate thing to do. So these pharmacies should not be compounding this bootleg semaglutide sodium and be allowing people to give it to themselves. That's my opinion. I think that's the opinion of others. And I have never administered semaglutide sodium nor endorsed it in my office. Let's get back to some basics here. So weight loss basics. Eliminate sweetened beverages. Just get away from those completely. There's no point. Are you a snacker? What do you eat between meals? How often do you graze, etc.? Portion control. How much should you eat? Well, you should eat however you can fit in the palm of your hand. You don't need to eat that much food. You're not going to die of starvation. I would, let's say, almost guarantee it. Timing of eating. Don't eat late at night. Don't eat after 8 o'clock. If you want to have a little snack close to bedtime, make it very low in calories, but just be careful about that. If you can do those first 4 things, you have a really great chance of actually making great impact on your weight and your health. If you get further beyond this and you start talking about food types, am I eating mashed potatoes with butter, or am I eating broccoli with a little bit of butter on it? That kind of stuff. So veggies versus carbs, and how much fiber are you eating? So anyway, I hope this was helpful to people. I hope that you could get some idea where some of these diabetic products came from, and specifically how they morphed over into the weight loss market legitimately. More is to come with these things. Don't forget your other dietary steps that we just outlined, what you should be doing with this. So I hope this was of benefit, and I'm glad you could watch, and we'll hope to catch you later for our next episode. Thank you.